It was difficult for me to get my fingers in gloves. I had no pain, but even to put your hand in your pocket to get change out or something out of your pocket, you'd have to fuss around. And it was a nuisance.
That's an abnormality which is seen in an older patient, typically 50 to 70 years of age. Dupuytren's disease is a contracture which you see in the palm, and it can bring the fingers down so they can't straighten out. And so it used to be that when this became problematic enough, and if therapy failed to improve the patient's status, we could take the patient to the operating room, make large incisions, and take out the disease process.
I was sedated, put under, and spent one night, maybe 2 nights, in the hospital. My hand was put in a gauze bandage the size of a volleyball. And so I was without the use of my hand for 4 or 5 weeks. There was no discomfort, but it was just kind of an awkward position to be in.
And now we started treating patients in the office where we use a simple needle and we break up the scar tissue, and in the office we can make a dramatic difference for certain patients. We've been very happy with the early minimally invasive results.
I was awake. This surgery was done on Dr. Goldfarb's desk in his office. My wife watched, and at the end of this, he grabbed my finger and straightened it out. It stayed straight.
There's not a large number of doctors, orthopedic surgeons who perform a lot of wrist or hand arthroscopy, and there's very few who do this new procedure for Dupuytren's disease.
And I think that's one of the things that drew me to hand surgery within orthopedics, because we get to operate on more chronic problems or nerves that are being compressed and use microscopes to try to improve those nerves' function. And at the same time, we deal with a lot of the basic trauma that we see in orthopedics, so broken fingers, fractured wrists, a lot that with falls on the ice or and motor vehicle accidents. Same thing with fractures about the elbow.
People are scared when they go to the doctor, even for something simple. And I do my best to try and assuage those fears and show them that it's just a hand problem and we can fix it. And if we can't fix it, we can certainly make them feel better, and we can help them live better and more functionally and in a more pain-free way.
Not all of the problems that I see need to be treated surgically, and we try to avoid surgery when possible. We have a great relationship with the occupational or hand therapists. They're in our clinic, and they help identify problems and help treat problems, and we try to avoid surgery if possible.
I found out there's a difference between good medicine and other medicine. And there is good medicine, and so you seek out good medicine, get a second opinion on everything like that. Barnes is a jewel of a place.